one that you would want to tell a friend, tell a friend, tell a friend to tune in because we are going to discuss drug, substance abuse, and the role of NACADA and its playing. Of course, it has been in the news in the recent past where there are those who are advocating that Kenya can grow bangi or cannabis such that we get out of the challenge of debt. What a day to tune in. Let's unpack it. And with us in the studio, we have the Chief Executive Officer of NACADA, Bwana Victor Kioma. Karibu sana.
Thank you.
We also have with us Dr. Yvonne Orlando, who is the Director of Public Education and Advocacy, Rehabilitation, and Regional Coordination. Wow, that's a paragraph to your name. Karibu sana.
Yes, thank you for having me.
Asante sana. Let's have this discussion. And Bwana Chief Executive Officer, let me start by asking, when did the rain start beating us on matters drug and substance abuse in Kenya?
Let me start by appreciating the opportunity accorded to us as NACADA to engage and speak to Kenyans about this subject. It is an honor, and really from the onset I want to indicate that we want to partner and push this partnership forward. Now back to your question, when did the rain start beating us? That is a fairly difficult question. But let me try to say this, that in my community, alcohol or, smoking, whatever they would smoke at those days, was only restricted to elders. And as a young person, you could only be allowed into the sitting of elders when you met certain requirements. Like you had behaved well, you had, married, or you were a certain age. That's when you would be allowed to sit and drink. Then there was nowhere you would go and drink. And basically, drinking was then allowed for a purpose. There was something the elders wanted to discuss. One of them will do some brew and ask elders to come and join in the drinking as they discuss. I believe that was the case for many of the African communities. If you wanted to know where the rain started beating us, the question I will ask is, when did we allow everybody to start drinking? Including minors, including young people. When did it become normal that you can just go everywhere, there are bars everywhere you can access? That is where the rain started beating us, in my view. Because drinking now has become like everybody's drinking, young people are drinking, students are drinking, they're abusing drugs. When that happened is where the rain started beating us. When we removed these restrictions that only certain people would drink and at certain times and for certain reasons, that's where the rain started beating us.
Dr. Orlando, if I may just come to you now. In matters drug abuse, substance abuse, let's go back to the basics. What is a drug and how can it be abused?
Okay, thank you for that. Now, a drug is any substance that when you take, it changes how you behave, how you think. So you're looking at, even if this water, if you take this water right now and you're this calm, but after taking it, you start talking louder or more, or you go down, or you just want to sleep and you're zoning out. You're saying it has changed your mood, it has changed how your mind is working. It is a drug. So anything that will interfere with your system. Now, when you're looking at abuse, if I may just refer to DSM-4, it summarizes it very well. If you're operating anything and you've used the substance, the aspect of hazardous situation. For example, you're drunk and then you're driving. That's a hazardous situation. You can kill others and yourself. If you're drunk and you're even crossing the road, you're saying you're abusing because you won't be walking straight. So you're putting the driver's life at risk. Interpersonal conflict. If you're drinking and others are complaining, there is a problem. If you're drinking and you're not paying rent, you're not paying school fees, there's a problem. Failure to fulfill obligations. For students, for example, you're supposed to be in school, but you snuck out and you drank somewhere, you're failing something. Same for parents, for children, anyone. If you're not fulfilling your obligation because you're drunk or you've smoked something, you're abusing. Issues of legality. Is it legal? The fact that you're smoking that cannabis you mentioned, and it is illegal, you're abusing. So it's usually not in the amount. It is in how it impacts you and others. So with the substance use and substance abuse, it's a biochemical thing. So you can take your 5 bottles, I take my 5, you drink and have a blackout, and I'll be there wondering, hey, na huu ni msofti aje. But you see, the impact is there. Yes, so that is just in the simplest terms.
In fact, if I may just
Yes.
join in. For me, addiction is when you can't do what you normally would do without going back to a drug.
Yes,
Right? You can't sleep because you didn't take your drug. You can't concentrate because you have not taken something. So that dependence on a substance before you can be normal, before you can do things a normal way. To me, that is now the addiction. And that is the biggest problem because you can take your tasker and you do your things the normal way. But when you get to a stage where you can not, for example, sleep until you take something, you cannot concentrate, then there's a problem. Then addiction has set in. That's the way I would explain it in my own way.
Now, we find that who are the stakeholders? Because, and I'd like maybe to speak to now the role of NACADA in the fight against drug abuse, substance abuse, addiction. Because there are those of us who would see NACADA as that cop, that enforcer with a stick. And we're in a society that is so, the earth is hard, they say, Pressure kila mahali. Shida mingi. So we then would want to run into escape, get into corners, and then only behave, be aligned when NACADA is around. When you're not there, we go on with the mischief.
By the way, what you are saying reminds me of people who call and say there's a bar that has not been closed here. Where is NACADA? and that bar is somewhere in the village where there is a chief, where there is a police station,
Yes.
And they will want to blame NACADA for a bar that is not been closed when it should be closed. Let me go back to the question you asked and say NACADA is actually a national agency that's mandated to coordinate a multi-sector response to the challenge of drug abuse in the country. By mere fact that you are coordinating means that you are putting together a number of actors to be able to move or to respond to the challenge. And therefore, NACADA alone doesn't operate. In fact, if you look at the board of NACADA, it brings on board very many agencies, representative of the church, youth, ministry responsible for security, ministry responsible for education, and for a reason. So even in our technical level, we also bring together all these agencies. The reason is that to address the challenge of drug abuse, you need everybody's participation. That's why in our board, Dr. Gallo, right? He has come there to bring the perspectives from the faith-based community. That's why he's there. So therefore, NACADA is responsible for, mobilizing agencies, partners to respond to the challenge we are having, which is the challenge of drug abuse in the country. And we do it by, conducting research, various surveys that inform our programs. And that's why I say that whenever we have a finding that indicates that there is a problem in parenting, the question would be, how do we now engage to address the parenting issue? Whenever we carry out resurveys and we indicate that drugs are penetrating schools because of the kiosks around schools, or because of the staff within the school, premises, we now have to sit down and think of how do we design a program to address that challenge. So in a nutshell, NACADA is mandated to coordinate, and it does so by engaging partners. And in fact, this platform here, I want to promise that we want to continue engaging, because I know through this platform, we are speaking to very many Kenyans. And that is really the way we work as NACADA. We work through others. So if you see something that as a drug problem in a certain place, I will be asking, do we have the church that we are partnering there? Do we have the assistant chief there? Do we have somebody from the border whom we have trained? Do we have the health workers whom we have trained to be our eyes in that region? So it is not that you must see NACADA to be able to see our working. We work through so many partners, and indeed our visibility is more not about us, but about the partnerships that we have established.
You want to add something on the same?
Yes, if I may. Also, as NACADA, we have the mandate to coordinate issues of rehabilitation and treatment programs and the public awareness. We also come up with policies on issues related to alcohol and drug abuse. And I know the public will be asking, so what is this about, like cannabis? And we always go back, there are policies to that effect, there are laws to that effect, and as NACADA, we uphold them. Not on ourselves. As the CEO mentioned, there is the whole team. So we have the courts on this side, we have the legal system, all of them know this is the law, how do we uphold it? We have the enforcement team, which also helps us. But the ones who complain about the bars, we coordinate, But if it is a school situation like we had, NACADA comes in confidently. We have the guidelines. It is who do we need to train, who do we need to work together with to ensure this works. So we deal both with the demand reduction and the supply suppression to work together to ensure this is the way forward for Kenya.
I like you talked about conducting surveys to get insights to understand what is going on, and then you design intervention programs. How bad is the problem? We asked and we wanted to answer the question to some extent of when the rain started beating us. This rain that is beating us, is it getting a thunderstorm? How bad is it?
How heavy is the rain?
How heavy is the rain? And here, relative to, of course, other countries in the region, in the world.
From where I sit, this country has a serious drug problem. The surveys we have done indicate that we are dealing with a problem that is becoming complex and is growing. Okay, for example, the last, as an authority, we carry out surveys every 5 years. We have started the preparations. In fact, we have even collected data on the survey that we carried out somewhere in March. We are going to analyze this and we share with Kenyans. Let me talk about the last survey we did 5 years ago. The survey indicated that about 12.2% of Kenyans are dependent on or current users of alcohol. Tobacco, I think, was about 8.4. Miraa, 4-point-something% of Kenyans who are dependent on this. We did, again, of course, there are many others, including heroin and bang, which is the most abused narcotic in the country currently, and responsible for a lot of substance-related disorders. We did another survey just to try and find out how the situation looks like in our institutions. secondary schools to be precise, and the situation was completely worrying. Yeah, students a preference of about 3.8% are on alcohol. Yeah, on tobacco I think it's 3.6. What is even more worrying is when we did the survey on primary school in 2019, and we put these figures out to Kenyans too, and you can visit our website, look at it. Prescription drugs are the most abused in primary school. Yeah? The preference rate was about
23%.
You can imagine what we are talking about. So in a nutshell, this storm is heavy. This rain is going to wash a number of...
to become a hurricane.
It's going to be a hurricane. And indeed the message for Kenyans is that we as a country have a serious problem of drug abuse. It is becoming complex because they have come up with innovative ways of accessing it. You will find bangis being, laced with the cookies and the candies and juices. So it is a growing problem. We have also carried out a survey on emerging substance of abuse, and you will be so surprised about so many new substances of abuse that are not even known to us, new things. In a nutshell, we have a problem as a country, and I think what we need to do is call Kenyans to action. Unless we all join in the fight, we are going to even lose our generation going forward.
And like you say,
particularly of young people.
Like you say, acceptance that you have a problem is the beginning of that journey to now solving the problem.
As Nakada, I want to, and by the way, you can even hear it from Kenyans when they speak. Every homestead has been touched by a drug-related problem. I doubt whether there is any that has not been touched. And so when you talk about whether we have a problem, Kenyans will tell you they have a problem. You remember we had the secondary heads association meeting in Mombasa?
Yes.
Thousands of heads of institutions. The message was clear. We have a problem in our institutions. So we have done surveys in the general population. There's a problem. It's a survey we have done in our institutions. There's a problem, and the figures are there. We are going to, currently we are undertaking a survey in our institutions of learning, and universities and tertiary institutions, and I can guess it's going to be worse.
And if I may, with the situation also, you'll realize where there's substance abuse, there's a mental illness that comes up. So recently, the CS for Interior actually launched a very huge mental health institution that is coming up. And this is because the prevalence for mental illness is actually also going up. For cannabis, you'll find schizophrenia is on this side. For alcohol, you have depression, you have anxiety. And in most cases, this person might have been using the alcohol without knowing that now you're actually waking up a mental illness. Others will not look at it. When now you start walking around, you're screaming, you're chasing people with a panga and all this, you say, iyo, siyo pombe, that is something else. Yet it is alcohol. It is cannabis. It is all these substances that you're using. And they're saying, yes, the problem is huge. Now we need to work together. When now everyone takes their role, the parents do their part, then the children don't start. If they don't start, then these mental illnesses will also not come about.
Now, when you get back to basics, and one would pose a question, what is it that is driving people into drug abuse experimenting and otherwise? What is it? I mean, the reasons could be varied, but let's unpack some of those reasons and just go behind in the various different institutions, in the home, in society, in offices, in institutions, in the public. What are some of these reasons? What causes? What drives?
Okay.
That's yours.
Now, we have very many different reasons. So one, the key one is the peer pressure. Others are doing it, you want to fit, you know. your peers are smoking, you also want to feel like them because there's the glamour. You have the influence of the media. Like if the media are talking about it in this nice way, if they are overblowing maybe even statistics, you feel like, hey, am I the only one? Maybe I should also join in. Issues of stress. Some people don't know how to manage their own stress, so they decide, let me drink, have a blackout so that it is gone. Let me smoke so that I don't remember it. Yet after that, the stress is still waiting for you. Availability at home. You open the fridge, instead of finding yogurt and nice milk, pombe, all different kinds of brands are just there. And it makes you feel like, oh, this is the norm. Poor role model. If your parents are always coming and they're always drinking, the survey that was done, the one the CEO quoted, we had children, very young children, 6, 9 years old, who are drinking. Where were they getting it from? You come, you're the dad, you have taken, you leave it a quarter there, you say, take it to the kitchen. So the child says, when daddy takes this, he's happy. So you clean the glass for your dad. That is how the children start getting into it. And you're looking at all of this. Some work situation, so the work can be very strenuous or intense. For our musicians, the artists, people who are in the secular performing world, most of them end up using the substances. The examples they're giving is, I need to stay awake. I need to have this extra energy. But when you need it to perform something else, that is a problem by itself. So we have all these different reasons. Then there's the mental illness. You're having hallucinations, you're afraid of telling people, maybe because you fear stigma. In the process, you start using the substance, which makes it even worse. But now we look at the substance and not realize you had a mental illness. These are just some of the examples which lead people to use the different substances.
Actually, let me just say that she's talked about the fridge which has all manner of drinks. Actually, the survey we did it clearly indicated that parenting is a big problem. Because even when you ask yourself, why is drinking in a primary school? These are people who come and go home. Where did the drinking start from? Because the statistics shows that drinking is a problem in primary schools. And therefore, our survey clearly demonstrated that parents are a risk factor. A risk factor to the young ones. Because you will drive out family days, Saturday you want to go out, Sunday you want to go out with your family, Nyama Choma, your Tusker, and whatever brand you take, and the child, you chips and soda. You know how influential parents are to their children.
They see you by your action, and that is what influences them.
Yeah, so they will say, no, I want to feel like that. And they will join in. In fact, some parents literally just give their children to test. So that's why we started the program of positive parenting. Because this program was meant to create awareness among parents that parenting is an issue. Look at the influence you have and how it's impacting on the young people in your homestead, your children. After that age, they will go to schools. How is the school setting in terms of preventive programs? That is another challenge area. So the absence of this program, the influence that the parents have on their children, actually these things add up to bring complications in the issues of drug abuse.
There is the optics, which I call optics, and we need to go beyond it. It is good, but needs to go beyond. Every so often, and I suspect then NACADA must have been involved in that, when we see in media enforcement, opening day, all the boys and girls, those who are going to school, have lined up with their suitcases, and they're being frisked and checking and seeing, and then we tick a box and say, there's no drug in my institution. Sometimes what you see is not what is, and what you don't see is what is. And then now I'm the head teacher, and I say, no, in my school, they didn't bring it in, so we don't have a problem. But you have a problem. Yeah. There are very creative ways in some of these things being sneaked in. Did you play a role in that?
Now, allow me to take that one first. For NACADA, we have the guidelines. We have guidelines for basic learning institutions, which outline how should schools conduct some of these inspections, and then what. You don't just do an inspection for the sake, because if I've inspected you and then I find you have a substance that shouldn't be in the school, what do I do about it? One, I cannot just expel you. I'm supposed to do an intervention for you. In the schools, when the schools were being told to go back and you had to do testing, and very many schools were telling people, do a drug test, do this kind of test. And you're like, no, and then what? Because there needs to be an intervention. And interestingly, we have not had cases that, yes, we actually found people with a positive test results. Because as you said, the students are very bright. They borrowed urine from their relatives. You know, you just tell your brother, you know, give me this. The school wants a result. Yeah, the result's negative. We had clinicians who said parents were paying, give me a negative test result. Wow. So the schools will be happy that, yes, no, it was negative. But that wasn't the case because there's no intervention. If you may do a case of Kisii High, which was shown on TV, sniffer dogs and everything, but they only found 2 boys. And you see, the issue had been made to be very big, like all the students are using or something. But we're asking, why, are we sure it is only the 2 boys? Because for girls' schools, for example, they put in their sanitary towels. You know, you just soak it in some substance and you'll be using it. We have lotions that are soaked with the hashish oil. And these people are using the substances. So it is more of an intervention. From where we are looking at it, it is not just frisking, finding with the drugs and go. You're saying no, talk about them, listen to the students. They have something to say, you know, engage them, interact with them. If I find you using or you're in possession, bring the family, let us have this talk. As a school, how can we support you? NACADA has, when you go to the NACADA website, we have a list of all these institutions that are accredited for outpatient program so that you can be in school Saturdays. Can you be going for counseling? Then you come back. We know schools that are doing that. So for us, it is not just the searching, finding, and chasing. It is, if we find, what are we doing about it? Because we want your life. We want to restore you to the original you, you know, before the substance use.
The optics are good, but they are not enough. And I think she's talked about the guidelines. These guidelines were, actually I would call them the Ministry of Education. We only assisted them to develop them. These guidelines will give you the steps that you need to take to handle a drug situation in your institution. But I must say that for us, we advocate for a package of interventions. Screening would be one of them. But counseling and merely creating awareness is a whole set of things. Even when you find a case of a student who has a drug problem, our focus is how do you address that? And the focus, this is actually, addiction is a health issue. So you don't criminalize. This is a patient. You need to handle this person like a person who is in need for an intervention that will change that situation. And therefore, these guidelines are meant to help the school administration to respond to a drug situation in their institutions. The biggest challenge we have currently is that many institutions do not have somebody with the necessary skills to be able to advise and to be able to handle such situations. Of course, we have counselors, but they are basically not in addiction management. They are counseling other things on how you can do well, and you want to go to be an advocate. What you need to do. Those are the kind of counseling things that they will do. But we are saying we miss that critical skill of somebody with the competence to say there's a drug issue or to basically run preventive programs within our institutions. And that's the appeal we are making. Can the institution ensure that within the establishment there's at least somebody who has the necessary skills? And as NACADA, we are willing to, provide that kind of training so that we can have some specific, and we have done it actually for a number of schools, We have had occasion to train a number of teachers to be able to have the competence to detect and take action against any drug-related issue within the institutions.
Now, you find that there are creative ways, like we say, innovative ways in which access, you pointed that out, people being curious, being influenced by the celebs in media, and those that, you know, we think they're living a glamorous life, that's the lifestyle that we want, and yet we know behind the veneer, there's the reality of the pain, the suffering, the challenge that exists. What are some of these creative ways that you find students, the public, are accessing the drugs and become addictive?
Okay. Now, if I may start with alcohol. For the ladies, the tampons, we've had cases where the ladies are soaking the tampons in alcohol, then you allow it to dry. So later on when you use it, now you become intoxicated. Even just the sanitary towels, they put them so that you're high. We've had the others sprinkle some heroin on top of the pads. For others who are cooking cannabis, yeah, apart from the cookies, you know, we are hearing cases now that they're blending it so that it mixes with some milkshake. We're having people karangaring, you know, you fry the sukuma wiki with the cannabis. And they're sold some, especially for universities and colleges. They're actually just sold outside the gates of the schools. This is how people are bringing in the substance. Cigarettes are not illegal. So the challenge with that is then the cigarette is what they're adding, the heroin inside. It's that cigarette that you sprinkle some of the substances you want to smoke. And this person is always high. We have the hashish oil that others are, you know, you apply on your body like a body lotion. So the person is seated and they are never, you know, you never see them smoking, but this person is high. For the pills that they mix with their other painkillers, and you assume the person is taking a painkiller. This person is on a D5, you know, they're on some sort of a tap-tap, that they, when they take, they actually will get high. If you do not talk to them, you won't actually realize, because they're the ones who tell you. We have the ones, we've had cases of students mixing some concoction, cough syrups, and some pain medication. You take, and you're high for like 3 days. These are things that they're doing. If you talk to them, they'll actually tell you, but if you become aggressive, you do not know. And you see, if you do not know, then you do not know how to intervene. So the challenges are there. When we become clever, they become cleverer. So we have to keep on interacting, yes.
The innovative ways are growing in complex. And by the way, you can't, you know, the way they innovate is so fast. No, you might find somebody with a pen and they is dispensing some tobacco product in it, and there is a pen. That's why I was saying, even when you are doing screening, those boxes, if you see some tablets there, so you will believe this one is somebody who is medicating himself. And I've told you the results, prescription drugs are most abused, both in secondary and, because teachers will just see the tablets and they will just say, that's okay, you must be suffering from something. But that is a drug, and the person is going to be high on the same thing you have allowed. You sniffer dogs can only sniff certain, not everything. So that's why we are saying that it is a combination of a lot of the interventions. In fact, sometimes you might open the box of a student and you find it is a juice. That juice is cannabis laced. And the person will go there, or there are cookies. That is why I was telling you that competence of identifying a drug is required in our institutions. Otherwise, you will see some juice, some drugs, you know, some pen, and all these are drugs. Those are modes of dispensing. So it is a complex thing.
And how complicit? Of course, in every society, you'll find there's, they say every village or every marketplace has the odd one whose network has gone off. And so it is, you have got rogue individuals in different professions and careers. And I'd like to speak to, the pharmacists, those who then dispense over the counter, and where you go and you are insisting on the antibiotics because, you understand that it deals with the issue that you may have much quicker, much sooner, more effective, and you then get addicted to the same. And just because you keep on going and getting it over the counter, unwittingly and knowingly, you're actually getting addicted to it. How are you involved in creating that awareness of that being a challenge?
Okay.
That's a big challenge. And by the way, I will sum it as corruption. Pharmacists are clearly guided under their own operating codes on what should be dispensed and what should not be dispensed without a clear prescription from an authorized medical personnel. When you hear prescription drugs being abused, some of these drugs that are being abused, including Valium and all sorts of, they have been accessed from pharmacies. In fact, I have had a discussion with the Pharmacy and Poisons Board on the challenge we have seen, especially from these drugs they use to drug people in bars and steal from them. Those are controlled substances. You can't access them. How are they moving around with women who are drugging men in the bars?
And you're quite right. I'm curious because I'm told muchele. I don't know what they call it.
This is muchele. What do you call muchele? The science.
Rohypnol.
Rohypnol. That one. You find it all over. People are being drugged. If you go to the police station, and people who have reported cases of being drugged is on the increase. It is because of the weak control from the pharmacy in terms of dispensing without prescriptions. And that is a big challenge. In fact, we have raised this concern to the Pharmacy and Poisons Board, who are actually supposed to be the one taming these pharmacists. And we are hoping that through their umbrella associations, we will be engaging them to say this one is a problem that is caused by your weak controls and corruption, so that we can deal with it.
And men, here I'm talking about men with the challenge of erectile dysfunctions, and then thinking that they'll prove themselves by accessing, and they get addicted to it. Is that a problem? Or is it a good problem?
Before the CEO says, it is a problem. Now, you're saying is as men, the challenge you're having now is the young men. Yes, the young men who are using this Viagra and other substances, assuming it will improve their performance. Now, the challenge is they don't see the long-term impact. It's supposed to be a medication for a purpose. But now we have young men abusing it because they're using it when they are not supposed to be using it. You've had the issue of young men with older women and all that. So it has made this abuse to increase. And then we are having now this men now facing the real challenge of the erectile dysfunction, and now the medication is not working for them.
So they go for overdoses and then
they're using it unnecessarily.
Yes.
And now they need to keep using it. And now they're getting to a point whereby it's not working. And now naturally also not working. So they're creating a new issue, new challenge that is now upcoming. For the older men, maybe you can add.
No, for me,
You eat groundnuts.
what I would say, I hear about those things, and what I hear more about is people who have lost their lives because of excess levels of consumption. What I would say is it's an abuse, isn't it?
It is.
It's a dependence. If you have reached a point where your old days are catching up, you hang your boots. You don't go to look for, unless it's a medical condition, which we will advise you to see a doctor. If the doctor says, no, your time is up, you just retire from the, the field.
Yes.
But I must say that those are things which are on the increase. People are losing lives because of using them. Some of those things are, even there are others. People are just lying and creating some concoctions which are not the real thing. And some of them are very, very negative health consequences. So my take is that this is just an issue that really speaks to the abuse of these substances and the unregulated pharmacists that dispenses drugs that they didn't dispense.
I'd like to just come to the survey and then we'll get to the International Day Against Drug Abuse shortly. Your survey in institutions, have you also conducted within, I'm curious, within the disciplined forces, within church institutions? Because there are places where we might be thinking that there is no problem there per se, but there could be a challenge there. So I could be running to my pastor, but he has a problem. And maybe he's the problem.
We have not specifically zeroed in on the discipline service.
And theirs is a very stressful environment.
And what I can tell you is that we have had surveys on workplaces. Workplaces is like, my organization. You do a survey there, you sample some of these MDS ministries, agencies, and departments. The police will fall under a department or an agency. So from the surveys we do, I can tell you that compared to the general population and the workplace, there is a serious problem in workplaces. There are more preferences, higher preferences of abuse, and it has something to do with your means. If you are in an organization that pays well, you will find more of the addiction-related issues in such organizations. If your organization is not paying well, you compare to one who is paying well. And we did this, in fact, like the last time we did, Kenya Ports Authority was having fairly high preferences as compared to the ones that are not paying well. So there's a correlation between how much you earn and the abuse. The people who earn more will have more issues about addiction. That trend has been set out in ours. So I think we might have to look at, when we were doing this workplace surveys, whether we picked the police as an institution, because I know we are doing analysis. This is something we did not long ago. But I can tell you from where I sit, there is a serious problem of addiction in the institution. In fact, the Inspector General is on record as having said that we have over 2,000 people who cannot work because of addiction. I can tell you, even in we are under the Ministry of Interior and Coordination of National Government. I can tell you that we have staff even within the ministry who have challenges, particularly the chiefs and other people down there who have a lot of issues. So yes, we haven't specifically picked an institution like the National Police Service, but I can tell you there's a big problem in our workplaces, which affects productivity, which manifests itself in discipline issues, which manifests itself in absenteeism from the places of work, which manifests itself in terms of the concentration of and hours you put on your desk. All these things have clearly come out from the surveys we have done. And I would guess that the police are fairly affected.
And you mentioned the church and the clergy. We have not done a study on them, but we actually have interventions for them. We've had different faith-based organizations coming up, from the Islams to the Catholics to the Pentecostals, coming up to, can we get this training? Can we get this intervention? And of note is the first rehab that was started in Kenya was actually started for the clergy. So we are aware that even the clergy need support. And even when they come in, we approach you from you are a human being who has challenges, and this is one of the challenges you're trying to work on. We have rehabilitation programs that are faith-based. So you'll find they read the scripture, they might be reading the Quran, but you're adding some science into it to ensure that it is holistic. So we have not neglected the church.
Now, the 26th of this month is a very important day.
Yes.
We have the International Day Against Drug Abuse. Why the day? What is the theme? How can we be involved? What are the activities?
Okay. So IDADA, which is that International Day Against Drug Abuse and Illicit Trafficking, it actually started in 1869. And the idea behind IDADA is just to have a day where we lay the facts. It is the facts on what interventions are working, what is the situation in the world. Now, during IDADA, UNODC usually gives the World Drug Report, which gives a status of the whole world in terms of prevalence in substance use, new drugs coming up, new interventions, and maybe even the progress that you have made. For this particular year, we have our theme, which is addressing addressing drug challenges in health and humanitarian crisis. For the past 2 years or so, we've had the challenge of COVID. And if you remember that time, the lockdowns, students missed out on school. We had so many parents have issues of domestic violence. I think it was reported to be about 35% on the increase. We had divorces happen at that time. We had deaths happening at that time. People were not using substances before started. Cars turned into bars. You know, you just go to a park, boot open. And these challenges were glaring. Lives have been impacted. Substance use, the prevalence has gone high. Now it is a time to reflect. How can we best support? What do we need to do so that we don't get there again? We need to empower the ones who lost it, the ones who are still traumatized. Globally, we have issues of Ukraine and Afghanistan and the wars that are going on. So this is also the time to recognize that when these challenges are going on, people are not accessing healthcare. In our own situations, people are not going to hospital because you're afraid. They'll say it is COVID. So people suffered in the process. Others were just not able to because the hospitals were full. So you could not access the health care that you needed. So at this time, we are highlighting the impact was huge. How best can we support and protect and prevent this from happening in future?
This day was set aside by a special session of the UN General Assembly to create a platform to speak out, for countries to speak out about the challenges they're facing with drug abuse in their countries, and to take measures that will ensure that we counter the world drug problem. This day, in my own terms, is to celebrate or to mourn. Celebrate if there's anything that we have done towards trying to address our specific country drug problem. And to mourn if we have done nothing. And I can tell you that as we get to Sunday the 26th, of course, we as a country, we have done fairly well compared to many other countries in the region. But there's a lot still to be done. As we celebrate, we have a national focal point that is supposed to coordinate response to this challenge. That is a good thing. Many countries in the region don't have a national focal point. We have an awareness level, I think, of close to 90%. Of if you go to anybody in the country and say, do you know of a problem that is related to a drug? Yes. Do you know alcohol causes problems? Yes. Do you know Bangi? Although some people are pushing for legalization of the same, do you know it as a problem? Families will tell you, that, yeah, it's a problem, I know so and so. So in terms of awareness, we can celebrate we have done quite a bit of it through the campaigns that we have been doing. My area of concern as we go to this day of Dada is that we are saying the country is facing a serious problem. Alcohol abuse contributes to, I think, about 10 point something percent of mental illnesses, substance-related disorders. What as a country have we done to address the challenge of these mental issues? I am happy the president has made very, very positive pronouncements about our mental health issues, put in place a task force that went around the country because the president has this feeling that we have a serious mental illnesses issues in the country. And I think he has pronounced Mathare Mental Hospital should be expanded. And there is another hospital, I think, that is coming up. These are things we need to celebrate as a country. My concern is that drug and substance abuse or drug control generally, if you look at our new constitution, was devolved to the county governments. Ask me how enthusiastic in terms of programs, in terms of creating awareness, how much is our counties doing? I can tell you that is an area of great concern. Not much is being done. And this is an opportunity we want to raise to challenge counties that you have a responsibility to respond to the challenge of our people who are afflicted by mental illnesses, addiction caused by abuse of drugs. And you need to respond by investing in prevention programs. You need to invest in creating rehabilitation facilities so that those people who have these issues have a place they can go. As a country, I think in excess of 90% of the facilities that are accredited by us to offer rehabilitation programs are actually privately owned and fairly expensive and inaccessible to many Kenyans. The way to address this challenge is to be able to encourage county governments to invest in these rehabilitation facilities which are publicly owned and which will be more accessible to more people. I want to take this opportunity to appreciate the partnership we have had with, I think, about 10 or so counties in which we can now say they have put up these rehabilitation facilities. I can remember Nyeri, Kwale, Kisii, Bomet, Kakamega. We have what?
Kodiaga.
Yeah, Kodiaga. We have Taita Taveta. I think there are about 10. I want to commend these ones and to challenge the rest of the county governments to try and do something about this problem by creating, by providing resources for preventive programs, creating strong directorates within their governments that will address this. The equivalent of NACADA, they should have it in their own counties. They should invest in rehabilitation facilities and train staff to man those facilities to be able to address this growing challenge of addiction that we are talking about. That is what we need to celebrate. We also need to celebrate the fact that with the Ministry of Education, we have now guidelines that are in our institutions. Those guidelines is like a handbook on how to respond to a challenge of drug within our institutions. What are things we're going to celebrate? We have actually, as an authority, working with the Kenya Bureau of Standards, come up with the standards on management of addiction, which should be able to give guidelines by rehabilitation owners on how to manage how to manage rehabilitation within their program. Because that's an area where we have all manner of hawkers and, and professional fellows coming up, establishing a rehab. They don't have the relevant skills. They don't have the serene environment for purposes of rehabilitation. These standards will help standardize the practice of rehabilitation in the country. I think these are some of the things that we will celebrate as we mourn the fact that we don't have enough facilities, the fact that we still have a lot of challenges that in terms of skills to respond to these challenges, like I mentioned in our institutions, this is an area we need to focus going forward.
Now, I'm not sure because you picked up, and I'm glad some county governments have responded and engaging, and you can see that it being devolved is actually having positive impact in terms of addressing the challenge that we have. I'm not sure on your board, maybe I'd lobby, even though they're now in the political phase, when you have governors in place, and engage with the Council of Governors to actually have a liaison person that is, so that then they can be able to be tracked and disseminate through that. I'm lobbying for someone to get a job. However, they need to get in fast into office, but it's more of the structure, not so much the individuals. And how much we are on a faith channel.
Yes.
How can the church be involved in supporting, even in the activities on the day and beyond, so that we don't see it just as a day to milestone it, and then after that we wait until next year, same time, then we say, see you then. How can the church be involved activities, even on that day itself or leading up to it?
Okay. Now, I'm glad you brought that up because this year's Idada is on the 26th of June. This is on a Sunday. So the church could come in by one praying for Kenyans, and especially those who are already struggling with issues of alcohol and drug abuse on that particular day, bringing in the awareness on this is substance abuse, these are the impacts that it has. Now, after Idada, we would be very happy to work with the different faith-based organization and the different churches in the sense that substance abuse affects health, it affects families, it affects relationship with God. The spirituality aspect is all affected. Now, some of these are principles that some churches actually have in their forums. If it is the health department, we could have programs with them because we have a counseling and treatment department. We could do trainings, we could do awareness creation together. For the youth, we have programs that target youth out of schools. We have programs that target children in schools. We have parenting. The CEO had mentioned about the positive parenting. These ones target the parents, how you can best work with the children. So we have all these different ways that you can work together, and we are very happy. Even with the media, we can ensure all Kenyans in every part of the country are able to access this information.
We want to actually bank on the church to be our voice out there through their own channels, through their own huge network. I know you have a big network. Just speaking to Kenyans through your network and trying to remind them that this country has a problem and that this problem you have a role to play as an individual, as a parent. Because we have talked about the issue of positive parenting and negative parenting. We know that you have a big constituency of parents within your network. We would like you to reach out to them, particularly on the coming Sunday where you will be praying. I hope that you can have at least some 10 minutes to speak about this problem and to address Kenyans and tell them. In fact, help me to remind even the county governments that they have a responsibility to respond to this challenge by investing in programs and by building rehabs and by doing research that we tell them there are specific situations. Because when we do a national, the picture will be lost when you go down to the county. If you do a county-specific survey, it will help you to actually get the clear picture of your drug issue. So appeal to them, speak to them, And please, going forward, we want to continue strengthening this partnership. We want to work
I want
together.
to end. We have less than 30 seconds, but I want to end on a high, no pun intended.
Yes.
I want you to debunk or confirm this myth on legalizing cannabis sativa for economic gain, where examples of countries are being given, they have legalized, so we can. Under 10 seconds.
Thanks for that opportunity. Let me say that Kenyans are being taken for a ride with the messages about the legalizing or the countries that have legalized. I can tell you from where I sit, Uganda is being said to have legalized. Go to Uganda, you can't traffic, you can't smoke in public, you will be arrested. The only thing they have done is they have actually started a plantation kind of, and it's controlled for pharmaceutical and for industrial purpose, not for recreation. And when people speak about legalizing bank, they should come out very clear whether they are talking about legalizing for recreation so that you can buff around as you move, or whether they are talking about legalizing it for economic purposes. So that, and before you say legalize it for economic purpose, tell us how you are going to ensure that it's not diverted into illicit market and mess the country the way the South American countries, they started their plantations for pharmaceutical industries in Europe and in America. You know how the Colombia and Mexico and Peru, those southern, how they have suffered. So when you talk about legalizing, tell us how you will avoid the diversion. Tell us how you will avoid even this pineapple plant here. You find they steal and sell it on the roads. What happens when you legalize for economic purposes and then it's diverted into consumption by locals? You will have a serious problem you can't manage. This is not something to joke about. It is a serious thing. Don't talk about Zimbabwe. South Africa has legalized. You cannot smoke when you are next to somebody. For recreation, you hide yourself in your own space. These facts should come out. Don't say South Africa, Uganda, Zimbabwe. Even in those countries in the US where they are saying they have legalized, only 8 states out of 52 have legalized. And there are controls. You authorize those people who are going to dispense, and you make sure that they don't give beyond a certain gram.
The tract.
Yeah? This thing you need to ask for details. Don't just make statements, legalize, legalize. You're lying to Kenyans.
And on that high note, no pun intended, we've come to the end of The Leader today. Thank you so much, Bwana CEO Victor Okioma from NACADA, and Dr. Lando. It's been a pleasure. And we are compliant. Out of the 3, gender rule, even in The Leader, we're compliant. Next week,
Thank you very
same
much.
time, see you then.